So if you see this, there is a little bit of a block on the right side. Can you see? With the left side the passage is more, right side it's a little bit blocked. But it's not a very severe issue that you are having. It's very minimal. I mean, the block is not like complete or something. This area, see? The light means it is air is there. There's no gap means air is there. Or the block is there. Anyway, we will solve it. Even though there's a small thing or a big thing, we'll have to work on the septum. That is definite. So we'll do that. Then, alright, so what exactly the shape of the nose that you want me to change? Yeah, sure. Okay, I will do that. So that's going to be bigger. But length and width is okay. It's not too broad for you. So if you increase the length and the tip projection, it should suit you. Little bit. See. So we need rib, huh? Then you have something called as chronic sinusitis. Because we are doing only surgery in the nose and the septum. Sinus is here. Turbinate reduction is not a good procedure. It's empty nose syndrome. We are only correcting the deviated nasal septum. Block nose sinusitism, allergy. Some people it will improve, but there is no guarantee. Sinus issue, if it continues, we have to do what is called as FES, functional endoscopic sinus surgery. I am not the best person for that. You have to get another surgeon to get that done for you. But that is a separate procedure, not a nose, it's on the sinus. Laser surgery or endoscopic, functional endoscopic sinus surgery, FES surgery. So here our ENT surgeon does it, I don't do that. Other nose share this because it's all in the same area. This is 100% area, especially the sinusitis or the allergy. Don't think it is because of the nose. It is because you have already inherent problem in the sinus. It's not in the sinus. If you see already there are some things inside the sinus. But it's not too bad your sinus also. So I don't think. That we are not going to address now. After surgery also. Just for you to understand. Yes, yes. Nasal clear out. Sinus clear out. Operation correct. Septoplasty is the sinus port. Septum septoplasty. But the complaints sinusitis in this. Sinus there is septum there. I'm just explaining that to you. See, a patient can have a problem in 2-3 areas. So you are having little problem in your sinus and you are having a problem in your septum. Both can cause this kind of blocked nose, allergy and things like that, headaches and all, especially headache is more with sinus problem. With septal problem, allergy, breathing, blocking, all that will be clear. Whatever is related to the nose, that will be surely clear. But whatever is the sinus, it will not be clear. And that you have to understand because you have both the issues. Many people don't have both the issues. So we'll finish this, you wait for 6 months. If you're very happy with the breathing and improvement is significant, don't do anything. Otherwise, you may have to do a sinus procedure at that point in time. If it's like not improved much, especially your blocked nose, your breathing or your headache and all that. Blocked nose will be clear, sure. We'll go with it. You also want a sharp tip Done. So when would you want me to do this for you? You had food at what time? In the early morning? Okay, we can do them today. Cheers. Please here. Okay, first सर्जरी रेडी करना है सर्जरी के लिए तो रिजो के पास भेजो और ब्लड टेस्ट कराओ then we start.
Days number of stage review.
7
days. Okay, after that we have 8 days.
7 to 8 days.
Okay, after that we have to take any precaution.
Yeah, total healing might take 3 weeks.
3 weeks.
Where do you want to travel to the Gulf?
Yeah.
After 2 weeks?
We have to be here.
When do you want to travel?
17th.
17th is, 15 days away, right? We can go, I think. Both of you want to go on the 17th?
Yeah, keep us.
Yeah, you can go on the 17th, I think. Should be fine.
So any travel inside India is advisable?
Yeah, sure.
Until Mangalore.
You can go.
We have another plan also for that.
You can go. Not travel as if for a holiday.
And not holiday. We have, it's the kind of a pilgrimage. We have to go to Kolor,
Mogambiga and all. Yeah, that you can do. Don't exert much, but just go and come. Because this is not a minor surgery. But really you can do that as long as you take care. Nose should not get pumped. We should not go to dirty places. Must not go with a lot of dust. You see in India how it is.
That's it.
To go to a temple, as long as you don't catch an infection or all of those things, it's better.
And what do you think?
Yes, it's something you should. I won't say no, but you got to be careful. Crowded areas and all, And especially very soon after surgery, you'll be going. If it's after a month, no problem. Sure. No issues. But if it's like a week or 10 days, maybe better avoid it. I would think it's safer to avoid it. Especially now getting this COVID around the corner and all masking rules. You have to wear mask continuously. We're working here. Wearing mask is not a good idea. So when you're outside, you'll have to protect dust, some contamination.
Here we are in the pre-med area about to shift this patient for a rhinoplasty surgery. She has a few cosmetic concerns but majorly a functional complaint. She complains of blocked nose on the right side especially. And how long have you been having this blocked nose?
I don't know how long it's been, but recently I have a problem with the blocked nose and sinus problem.
Okay. And if you look on the sides, this patient has a mild dorsal hump that we are going to reduce. Also, she wants to reduce the flaring of the alar base. So, alar base reduction is planned bilaterally. So, overall minimal cosmetic improvements is what she desires, not too much, but she wants the length of the nose to be increased by a small extent, along with resolution of her functional issues. So this procedure is going to take us over 2 hours and is going to be an open structure rhinoplasty, and then we will show you the post-op outcomes.
Patient with injection propofol is 50 kg female, so we are giving 100 milligrams of propofol as an induction agent. Shoulder. Height around 6.8. Okay, it's okay.
So it was a septal rhinoplasty. With rib harvest. Okay, now the bill's in view. Any pain is there? No pain? I don't have it. All right. Where's your mirror? Have a look. Come like this. Little bit of that. Okay. What do you think? It's beautiful. Yeah, that is there. This is all because I just did the cleaning now. It's going to go off. You can see how we've got a nice projection. Look at here. There was a depression there. We've corrected that. These grooves are gone. Okay, nice sharp tip. And side view also. Yeah, you've got a nice slender nose like you wanted. Looks straight. Anyone's there with you? Oh, okay, you call him. Come. Huh? So how does she look? Tell me. I think she's looking very beautiful, right? The nose, see? It's got a nice line. See, this is important, this dorsal aesthetic lines. You know, you can see from the eyebrow, there's a gentle curve comes in. The next thing you see, this is a little broad, then it narrows. It's not one straight thing. And then it comes and joins at the tip. I do agree that the tip is not very, very sharp. But it definitely will suit your face, and if you see earlier it was really, really broad and flat. So, and it's going to get better. Okay, this is just immediately 1 week later, a lot of bony work, we've removed the swelling. It gets better than this with time. Take good care of your nose till it heals. You leave today?
Yeah.
Where do you guys go to? Calicut, okay. You had come, you have to go to Mugambika, now I remember.
Yes.
Right. I remember. So careful when you go to Mugambika.
Yeah.
You said you have to go somewhere to the Middle East also,
Yeah,
correct?
UAE.
17th, huh? Okay. Right, so today is, we have not many days. So you have to be careful.
Four more days remaining to.
Correct. You have to be careful only, huh? Don't injure your nose, please. See, because a small knock also, yeah, it's a mess. Be very careful, traveling a lot of distances and all of that. And take all basic health precautions because you're going to congested areas. I've been there 2-3 times. Mugambika, it's very crowded. Too many people, you know, somebody might just hit you with the elbow only.
I cannot even imagine.
No, you have to be careful because they are crowded there, they'll be going like this. And you know, it's a pilgrimage site. You have to be careful there. I don't know how to tell you. All right, so she'll remove some of those sutures. We've used rapid for you quite a lot. Rapid means they're dissolvable ones, but we'll still remove them. Chalo.
In the discharge summary, there is mentioned the next consultation on 3rd June, something like that.
Don't come. Yeah, if you can't come, it's fine. You don't need to come. We just write because some patients are not very far or who can come. There's one guy who just come from Trivandrum today like that. Did you see this other guy who came? Yeah.
So the stitches for the ribs also will be removed.
They will take it off now. I hope they're healed. You have any pain in the rib side? Not much pain. Did you have pain after the first day?
First 2 days, but after I felt okay.
First 2 days you had some pain, little pain. Okay. We'll take it off today as long as it's healed. She'll check and do it.
So once it is dry, she can take shower.
She can take shower today. Taking shower is not a problem. You have to make sure the nose doesn't get hit anywhere. Even like this or gently, Because if we're not putting a splint, till now there was a protection on top.
I know nothing.
Whatever it is, all the bones have been fractured and moved to a new place, And it's not like we put plates and screws. Nothing is there. Unless it doesn't set in that place, it can move. So we'll be careful. There's one patient I remember has recently contacted me from somewhere abroad only, Middle East. So he went and played football. In fact, I told him no. After 6 weeks only he went. But then the ball hit and there's a slight deviation now. Yes, a little bit. But what happens, even if you have a slight deviation, we can't solve it with a simple problem. Again, it's a revision rhinoplasty. To fracture it again. So therefore, it's better to take care. All right. See you guys.